Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about answering the question, I have completed a medical billing and coding program. I have a certificate or a diploma from that program. Is this enough to get me my first job in medical coding? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. A lot of people will ask me this question. Blue, I finished my program and I haven't sat for my certification yet. I don't know what certification I want to sit for, or I just don't have the money to sit for my certification exam. Can I still get a job anyway with just having a diploma? The answer is two ways, yes and no. So here's the thing. I will start off with yes, okay? Sometimes an employer will say, if you have been through a official program that's approved with either a HEMA or AAPC, we will go ahead and take, education in lieu of experience, and we will give you a set amount of time to be able to get a certification. A lot of times employers either want the medical coder to already be certified, or they have to, because that is the rules in their facility, that the coders have to be certified. So within a certain amount of time of beginning. Some people have said that they started when they got, when they finished their program, they had their diploma with them and they said that they were hired on, but the employer gave them 6 months. Sometimes they'll give them a whole year. Sometimes they will give them 2 years, okay, to get certified. But your employment, continuing on with being employed with them is going to be contingent on you actually getting your certification. So if you're going to go that way, you're going to start going ahead and applying, but not having your certification yet, you may run into a little bit of an uphill, but it is not impossible, because I've heard of people being able to go in there with their diplomas or their certificate of completion and still being able to get hired on to start, but they did have to get their certification later on. Now, of course, there's the other way where you do have to have a certification and employers will overlook you if you do not have your certification. Here's the thing. These employers really do want to make sure that these coders are actually certified. And that is the point of having a medical coder, because a medical coder has to be technically trained and have these technical skills to be able to look at documentation, to be able to translate that documentation into diagnosis codes and procedure codes or evaluation and management levels. They have to be able to have this knowledge. So in order to have that, you really do need to be certified, so that you can say that you've displayed your knowledge and you have this already, this training. So that is what I will say about that. It is better when you have completed your program to get your certification as soon as you possibly can. I really do recommend getting your certification within 30 days of completing your program, up to 90 days, up to 90 days afterward. Really try hard not to go past 90 days when you've completed your program, because the longer you are out of your program, the higher your chances are going to be to forget a lot of the things that you have learned. Now, yes, I understand that if you're in school, maybe you don't have a lot of money coming in. Maybe that is all you're doing right now because you're trying to get out there, and I get it. But I want you to know that you are in for a really uphill battle if you don't have your certification already in hand. Now, a lot of people will complain and say they don't want anybody who does not have experience, and a lot of people will get discouraged when they see that all these places are asking for so much experience, 2 to 3 years experience or 5 years experience. How am I supposed to get any kind of experience if no one will let me in? There are many different avenues. I've always recommended starting off with medical billing, or if you can't get in with medical coding, try prior authorizations. There's a lot of different names that medical coders fall under, right? Or a branch of what they do falls under. With prior authorizations, you are getting a chart from the doctor. The doctor says, I want to do this procedure on this patient who has these diagnosis or this diagnosis. Call the insurance company, see if they will take care of this, if they will pay for it, or what will happen. So it is on that person who is looking at this record to make sure that it is supported. And if it's not, then you got to go back and talk to the doctor and go from there. but that will give you some exposure to codes. You won't actually be coding, but you will be able to use your knowledge about the diagnosis codes and the procedure codes to be able to make you a good fit for something like prior authorizations. There is also working in medical records. Now, medical records won't get you to coding, but it will get you around the people who are going to be hiring for the coding. Okay, so there is that. Sometimes you have to kind of work your way in through other positions. There's also release of information. Now, release of information is not going to get you coding experience, but you do have that technical training, right? Because we all get trained in HIPAA when we are in these medical billing and coding programs. So that is really what you need to have those values when you are working in release of information. Release of information is just like it sounds. Somebody's coming up to you and saying, okay, I want to get my medical record. They're going to be talking to the people in release of information. They're going to have that knowledge of what forms are going to be needed to fill out and that kind of thing. So it is the release of information people who are protecting the health information. And again, that is what we're trained in. So ROI, or release of information, falls under that umbrella of the patient administration. Okay, so if you're looking in the job listings, you're going to be looking for words like that: patient administration division, or patient information, that kind of thing. So you want to be looking health information technician. You're going to be looking under those terms, right? When you're looking for alternative positions, right? Not just ones that are for coding. Okay, yes, you want to still go ahead and apply for these positions, even though they're asking for experience. Apply for the positions that are saying that the job description is describing a coder, not an advanced coder. You want to stay away from those advanced positions like CDI, or clinical documentation improvement, or clinical documentation integrity. You want to stay away from those positions right now because you don't have the experience. People who do CDI have to have a lot of background and knowledge, not just in coding, but in the clinical side as well. They have to have that deep knowledge of the disease process and really a very good understanding of the procedures as well. So that's something that you can get into later on. But you want to stick to positions where they're talking about like outpatient coding, pro-fee coding, emergency department coding, that kind of thing. So, or inpatient coding, depending on what credential you have. If you have an inpatient credential, or you have the ability to be able to code inpatient, like you have the CCS or the CIC, then you can go for those kind of inpatient positions. So whatever you were trained in, you want to look for those types of positions. But it does take a lot of grit. It takes a lot of stubbornness to get out there. You're going to take a lot of rejection, folks, especially when you're brand new, and especially if you're not holding a certification. Okay, so keep that in mind. Don't get discouraged. Just keep applying. If you haven't sat for your certification exam, you need to really consider sitting for that certification exam as soon as possible, so that way you can still have all that training fresh in your head. Because I have heard from people who get out of their programs and they say, well, I'm going to study for a little while because I really don't feel like I know what I'm doing. Here's a little hint. We all felt like we didn't know what we were doing. I know that even for me, as hard as I studied, I felt like I wasn't really strong with everything until I was 4 years into being a medical coder. That's when things started to really click. Even though I was doing good, it doesn't really all like start to gel and make sense until you've been in it for a while. So you do have to be patient with yourself. So whatever you do, be patient with yourself, because that is one of the things that is one of the hallmarks of what you need. Patience and persistence. And that persistence is no joke. I tell folks also to apply with the temp agencies, and I'm going to make that my battle cry this month. For the month of October, I'm going to tell folks to apply with a temp agency. If you are a recent graduate, or if you newly got your certification and you're out there looking, the beauty of working with a temp agency is that when hospitals or facilities or doctor's offices, when they call in and they say, hey, we really need a medical coder. We need somebody to come in and help us out. Okay, great. If you've registered yourself with a temp agency and they've given you a test and you've done really well on the test, because they have to assess your skills. That's what happened to me. I went through a temp agency. They gave me a test. They said, if you do really well, we'll look for an assignment for you. I did really well. They told me, okay, give us about a week and we'll call you with something. And of course, I had felt so much rejection that I was like, oh, okay, just another person telling me they'll call me back and just ghosting me. But no, they actually came through. Sometimes these temp agencies get these contract positions, or sometimes they get these short-term assignments that are a few months. Sometimes you may be filling in for somebody who's on maternity leave. Sometimes you may be filling in when they have contracts come in. Like they'll get an assignment to code backlog, and you may be on that assignment. But you're never gonna know if you can get into something like that unless you apply with them. Now, having this kind of experience on your resume is going to add up. Even though it may be just a few days, maybe it might be a week, maybe it might be a few months, you'll still have more experience on your resume versus if you don't go with the temp agency and you're just out there still looking, you can't find anything. At least this way, you're doing a couple of things now. You're making really good contacts, because obviously if you get a temp assignment at a hospital, you're making yourself known. You get to show them your work ethic, and you get to go in there and really try to learn as much as you possibly can. Now, they may not be willing to show you a whole lot when it comes to the coding side, because they are going to expect for you to already know the fundamental basics of how to code. Now, if you don't feel comfortable or if you don't feel confident in that, that's okay. But make sure that you are still working through your workbooks, going on sites like justcoding.com. Justcoding.com is it has a free subscription and it has a paid subscription. On the free subscription, you do get access to 5-question coding quizzes. Now, I always talk about this. This is not an ad for them, but what an awesome free resource. Now, these coding quizzes, they are covering diagnosis coding, outpatient procedure coding, and inpatient procedure coding with ICD-10 PCS. So there's a lot of really good things on there. And again, it is free. You get access to that. What better, right? At least this way you can practice. Cover up the answers so that way you can start looking up things in the book. Well, Blue, I heard that they have encoders at the places that we may be working. Not all places have encoders. Encoders are very expensive. Encoders like 3M encoder. It is very expensive, but again, not all facilities have those. So you still need to be able to retain your skills looking up codes in the book. Again, not only that, it's going to give you that extra practice for when you do get those assessments from the employers to get to assess your skills knowledge. Okay, well, we know this person has been practicing in the book. So just have a little bit of patience, but get out there and be persistent. Have a really good resume, have a really good cover letter, especially when you are just showing up with a certificate of completion or a diploma and not a certification yet. Okay, guys, they're really going to be looking for those certifications. So I strongly recommend, if you're asking me my advice, or I'm going to go ahead and give it to you anyway, if you should go out there with just your diploma, or should you have your certification, I would recommend having your certification. Again, everybody's situation is going to be individual. So if you want to try with just your certificate of completion or diploma, then by all means. But again, it is going to be an uphill battle, and not just the fact that you have no experience, but the fact that you're not even certified yet. So just make sure that you keep that in mind when you're out there. There's also medical billing, guys. You can really begin your career, and many medical coders have began their career in the medical billing department or working with revenue, right? Because of the simple fact that you don't have to be certified to be a medical biller, even though there are certifications out there for medical billing. It is not required. You will see that in a lot of the job listings for medical billers, that they're not even asking for the individual to be certified in medical billing. Okay, so that is another avenue for you to be able to get in. So keep those things in mind. We talked about risk adjustment yesterday. Another position that you can get into as a brand new medical coder, risk adjustment, HCC coding. It is all diagnosis coding. And so sometimes I will see on those job listings, they're not even asking for the individual to even be certified. So that is something that could be an alternative for you if you are looking for that, okay? I'm just saying. But I'm gonna go ahead and wrap this one up. Thank you guys so much for joining me. I hope this helps you, and if it does, I hope that you'll share this video, because you never know who it will be helping, and I would truly appreciate it. Please give this video a thumbs up, subscribe if you haven't already, and I will see y'all on the next episode. Bye!